I was born in the war, I grew up in the war. I had a real experience in war. We had like 3 times our hut, this local hut were destroyed, and my father was killed in 1994. And then when the war comes, then you have to run for your safeties. I would say I got lucky because I'm still alive today. I was born at home 10 days ago. The main problem is the abscess on the breast. It's actually incredible to be with MSF. I'm working here as a clinical officer and I'm doing my internship. Basically, what it means is when you finish your training, you will be able to go to the community and help them, educate them how they can do the prevention. It's more about primary health care. Working in healthcare is a teamwork, it's not just an individual work. You may know something, but you may not put it in a correct way unless maybe you share it with somebody.
Okay guys, morning everybody. Okay, if nobody else has anything to add, we go on to departments. Kalazar.
17 patients, while we discharged 9 patients. The total number that we have now on medication is 54.
The breakdown of the staff in the hospital, as we said, is almost 95% national staff. The value of that is that it allows us to think further forward. It allows us to develop the people here to be able to run the hospital one day. There's a couple of scenarios. One is if we had to evacuate tomorrow, what would happen to this hospital? You want it to keep running. You want it to keep serving. You want it to help war wounded who come in for whatever reason. Because often when we do evacuate, it's for security reasons. It might mean our presence then is actually more relevant, but because of security reasons, we cannot be there. So they provide that. But also the future as well. I mean, we can't be here forever. We shouldn't be here forever.
All right guys, thank you very much. Have a great Monday.
I enjoy working with mothers and babies because there are a lot of things to learn in babies' conditions. And when you want to be a good health worker and you can be able to diagnose the condition of babies, then you can be excellent because most of them do not talk. It's now the mother tells them, they tell you the information. But most babies, the complication is you have to find yourself what's wrong with the baby. Sometimes the mother may not realize the child is having this, but through your examination and observation, then you'll be able to find. Again, also, yeah, they are little kids. They need to come out, so they also need to be cared of.
I started working in Leer with MSF. It was 2009, June, 16th of June. I came to Leer. Up to this time, I'm still working with MSF. But I worked before in Darfur, 5 years in Darfur. I'm really very happy to be a nurse and work in my country to help my people. If it's not MSF here, I'm sure people here in Leer will not survive. And why this one is running very fast, huh? I like to be a nurse. If I come to the hospital, in the ward, the first thing I have to greet all the patients. Tamam? Baba Fadwen. Oh, this is my patient. I like him. I have to ask them, how did you spend your night? Is there any problem? I used to sit near the patients. There's some patients, they don't have caretakers, especially in this county. Okay. Okay. Male. And who brought him?
He was together with the mother, but the mother went out and collected food for them.
Oh, good. The other Kalazar patients, they are dying due to lack of blood, and there's no donors to help them. They are coming from far places. They are traveling for 2 to 3 months to reach Leer. But they are always coming late. And some of them you will find one patient with Kalazar, HIV, TB, anemia at the same time. My job is a very good job to me, but I don't know to the other people. But for me, it's very fine. I like it.
A lot of support behind these expat positions. We don't have to think that we're flying solo here. No, those days are gone. We have the experience, and a lot of the team in the capital can be there to support any of these guys in the field.
We're actually going to the other side of Leer, which is Dop, the village itself here. This is Dop village. The reason why we came here is because we make an assessment. Yeah, we normally come here to collect information about malnutrition.
So we normally refer children who fall under the orange one and then the red. These are the children really malnourished, and then we need them to be admitted in our MSF program here in the Leer.
We've been trained local by MSF here in Leer in ways to go and track and trace those who are needed in the hospital, like the referrals and all these 6-1 and whereby, yeah. These are the things that we normally do them, but we get the training local here in Leer with MSF. As a members of Leer or as a part of the community, I'm really proud to carry on and do this work as they also benefit from me.
The feeling of patriotism you get from the staff here is phenomenal. You know, you cannot underestimate it. It's a new country. It really is something special to them. Maybe they don't have so much faith in their government and their systems, but it's South Sudan, and that's to them. And that I noticed, everybody would have left this hospital in April and walked up to Hegley and fought for the South in a drop like that, if they had the opportunity. If they realised they didn't have anything else to do, if they weren't here, you know, fixing up wounds, and, basically making sure that everybody's okay in these southern 4 counties, they would have done. And even everybody was thinking the same. It's incredible, incredible emotional, patriotic feeling they have.
I'm a South Sudanese, and one of the good things that I should work here is because it's very easy to understand the community which you belong. It's because of cultural issue and all those things. Because sometimes you may have difficulties in treating patients when you don't know the cultural background. So, but you know they are your people, and you know what they need, and it's also very important when you are helping your people. It's really very important. And I love working in South Sudan, and that's what I wanted, to at least help people with what I have. Yeah.